Thank you inviting me in Investor Fair 2021. I'm the CEO and founder of Bionia Corporation. This is a safe harboring statement, and I will talk about the company overview and COVID-19 say and our growth potential and financial highlight for the investor. The company is founded in 1992 as the first biotech with a PCR technology and oligonucleotide synthesis, two major pillars of our growth. And we have now the credit rate B. I hate B. I like A, but I hope in the near future we can be A. And our current shareholder, I'm the still major shareholder and institutional shareholder, and 68% is the individual. This is a brief history of our company. At the foundation, we commercialized the PCR enzyme and oligonucleotide. And in year 2001, we developed the first real-time PCR for the bioterror protection for Korea-Japan World Cup. This is the first Asian real-time PCR. And in the year 2003, the SARS pandemic, we supplied the PCR reagent to the Chinese CDC. After then, the new influenza pandemic in year 2009, we developed the swine flu diagnostic kit faster than Russia 2 months earlier, and then we supplied more than 2 million tests to the Korean healthcare facility. After that, we developed all the new pathogen diagnostic kit, including Ebola, Zika, and MERS, and COVID. And we also developed the viral load test kit for HIV, HBV, HCV, and resters in C. This is the unique Asian company who have the risk A, the viral load test kit, and we are now listed in Global Fund for this viral load test kit. Our business model is based on the disease prevention and diagnostic and therapeutics. We have two subsidiary company, is Biome for the probiotics for anti-obesity, and therapeutics company based on the RNAi technology. We have Sonagen Therapeutics, which have a very promising pipeline. And we have our main cash cow is the molecular diagnostic, and we supply the existation from the start of the COVID-19 pandemic up to now. We provide more than 1,100 units to the world. Our systems has some advantage from the small lab to large lab based on the daily test number. We can provide, we can customize our system for low throughput to high throughput. I'm sorry. We have developed the raw material for molecular diagnostics. So we now have the ton-scale phosphamidite production capacity, and daily 30,000 oligonucleotides can be synthesized in our facility, and we also have the 100 million the polymerase the production capacity, and we also developed our novel nano magnetic silica bead, which have the 100 kilogram production scale. This is integrated in the kit and run on our novel instrument. So we are one of the few companies developed all the raw material and molecular diagnostic kit and the system. So we warranty the total quality warranty is our big competitive edge. This is our IP portfolio in the molecular diagnostic kit and nucleic acid extraction and molecular diagnostic instrument. We have developed all the materials, and the manual patent is registered in outside Korea. This is our business portfolio. I just mentioned the molecular diagnostic, except the molecular diagnostic. We started from the life science research business, like the Thermo Fisher. We have a full the various product portfolio from molecular diagnostic, molecular biology research, and we now have more than 500 different kinds of the products from the siRNA and the nucleic acid extraction, PCR products, and the protein synthesis machines, and our the business part is a new drug development. Is operated by the Sonagen, and the probiotics business by the Ace Biome. Let me talk more about the COVID-19 assay. So we have two kinds of products. One is a closed system operated in our X station. The other one is open system. And we have a COVID-19 test kit and the COVID-19 and flu simultaneous diagnostic kit. And also recently we developed the COVID-19 variant identification kit. So I skip this one. And our kit is evaluated by the FIND, that's a WHO collaborator in the field of the diagnostics. And we have 100% sensitivity and specificity. And we have recently developed the variant ID kit. So still there are the COVID-19 virus fastly evolving even after the vaccination. So we are watching the variant, every variant, and developed the kit for the clinically important variant, the variant alpha, beta, and the variant kit ID kit 2 is we can also detect delta type. The current molecular diagnostics still have many problems, even though it is a gold standard for, as it is very sensitive and specific, but it takes some time. Just to mention the gene system, and it also have some the problem of the handling. The expert should handle this molecular diagnostics. So we developed the next generation, the ion qPCR, so it can be finished from sample prep to the result is just within 30 minutes. It can run the 2 samples, and the automatic extraction and real-time PCR can be done without any human intervention. And it's designed for the syndromic diagnostic, can detect maximum of 40 targets. This is another next generation the molecular diagnostic platform we are developing. Will be launched this year. It's the really first generation molecular diagnostics. So because the sample tube can be loaded without the cap opening, the machines within the machine, the sample tube is decapped by the machine, so it can run anywhere even in the office. So our growth potential, briefly introduced our drug development pipeline. We invented the semi-RNA. It's a next generation siRNA therapeutic platform. This is very unique because the siRNA therapeutics is a naked type or nanoparticle type by assembling the repeat nanoparticle. But our semi-RNA is a single molecule nanoparticle. It's a very unique feature. So it overcomes the major problem of the innate immune stimulation. So as you know, the Ebola virus, the therapeutics by siRNA is failed by innate immune stimulation because the major toxicity comes from the innate immune stimulation. So our semi-RNA is really free from the innate immune stimulation, so ideal platform for antiviral drug. This safety is confirmed in the preclinical study, including the monkey study. So it's a very safe profile. The NOAEL in monkey is 100 MPK, and the efficacy dose is just 5 MPK. So we have 20 times the safety margin. We have now the pipeline for antifibrosis, especially coronary-industrial lung disease is the major disease after the corona pandemic. Many patients still have trouble with the lung fibrosis. So we will start this clinical trial in the next year. And this is our growth in the last 3 years. And we also invest a lot in the manufacturing facility for the next generation molecular diagnostic. So this is our patent portfolio in each business domain. We have a strong patent in the new drug development and the next generation molecular diagnostic platform. This is financial highlight, and our total asset is 224 billion, and the liability is 61 billion, and total equity is 163 billion. In the year 2000, our sales revenue is 206 billion Korean won, and OP margin is 52%, and this year's first quarters, the 36%. And this is our the diverse kit for our platform, and the diagnostic kit, and the competitive edge of our instrument in comparison with the Roche and the Thermo Fisher and Qiagen instrument, smaller space and then more throughput. That is our competitive edge. This is a head-to-head comparison of our instruments. We recently invented the AccuRoader for high throughput sample loading, especially for the pooled assay. This is very accelerated the large-scale screening. Thank you for attention.